Hello everyone. This lecture is on the proximal pulmonary artery and Wilson syndrome. Now coming to the antenatal detection, there may be sonographic feature. Central nervous system can be 38% and the most common prenatal ultrasound feature is the heart defects. So in common arterial trunk in 30%, absent pulmonary valve in 40%, and the others in a small percentage of fetuses. Now the interrupted aortic arch, absent pulmonary valve syndrome, we see in the same vessel you get the origin of the pulmonary arteries and continue forward flow, which are the features, and the prevalence is about 16%. And here you see the absent finding described in the central nervous system is a dilated cavum septum pellucidum, which was seen in 65% of FGR or genitourinary tract anomaly. So any combination of these features, then you must, because of this paper and the various clinical features. Now this is the sagittal. 4 markers of the syndrome are present in this fetus, and as dependent on the ultrasound features in the fetus. Again the ultrasound features and or cell-free DNA is positive for this condition. Both are only positive screening results.